I spoke to a doctor tonight from UNC Health who focuses on treating people with high-risk pregnancies. She really wants people to understand how we got here with so much disagreement on this topic. UNC Health's Dr. Ebony Carter focuses on maternal fetal medicine in light of Monday's White House announcement about Tylenol in pregnancy. She wanted to emphasize how the studies that so many people are pointing to actually work. People who are pregnant are not included in clinical trials because of the risks involved. So the data for these studies has to be gathered retroactively.
What we are left with are studies where we look at people who took Tylenol and people who didn't take Tylenol. And in some of the early studies, there was some suggestion that maybe people who took Tylenol, their babies were at a slightly higher risk of autism.
However, she says it's important to consider why those people took Tylenol in the first place.
Those people were more likely to have an infection, chronic pain, ADHD, a mental health diagnosis than people who didn't take Tylenol. So was it the Tylenol or was it the underlying reason that they took the Tylenol? And so that's actually really hard to figure out if you don't have a randomized trial.
She did cite one study where researchers looked at siblings where their mother took Tylenol with one pregnancy but not the other.
What do you think they saw? There was no difference in autism risk. That's about as good as it's going to get in terms of studies with the limitations I've told you that we already have with pregnancy.
Dr. Carter added that from her standpoint, Tylenol is really the only safe medication option in most cases. If a pregnant person is experiencing certain symptoms like pain or fever and will not take Tylenol, she may be forced to take more extreme measures like early delivery in some cases, which carries a lot of risks in and of itself. We also spoke with David Laxton from the Autism Society of North Carolina. He echoed President Trump in saying more people are being diagnosed with autism than before, but there are a lot of contributing factors. There's more awareness about autism, so more people are getting tested. The criteria for an autism diagnosis has also expanded in recent years, meaning more people fall under the diagnosis than before.
In our state, there's a lot of people that have been working for a long time to make sure people know what the signs and symptoms are so that there can be that early referral for diagnosis.
He hopes Monday's announcement helps increase awareness even more about autism, allowing more people to get diagnosed and receive critical early intervention. Laxton also said the White House announcement about more money for research into autism is promising, and he's eager to find out what exactly will be used to study. While there is disagreement on this topic, there is consensus across the board on one thing. If you are concerned about this, the best thing to do is talk to your physician, have a candid conversation, and make the decision that makes the most sense for you and your family. Reporting from Raleigh, Sydney Schofield, ABC 11 Eyewitness News.